Hello, everyone. My name is Robledo Yamamoto. On behalf of my co-authors, Doctors Amy Voida and Stephen Voida, today I will be presenting our work From Therapy to Teletherapy, Relocating Mental Health Services Online. The COVID-19 pandemic offered a unique, though unfortunate context for learning more about the affordances of teletherapy. Even before the pandemic, there was a high demand for mental health services. The pandemic has exacerbated these issues and has also increased the demand for teletherapy. There is and will be a high need for mental health services through this crisis and beyond, and teletherapy makes it possible for many of these needs to be met. While the concept of remote work is not new, teletherapy is a unique type of online interaction that requires the client and therapist to establish a safe space where clients can discuss their concerns and take calculated risks in order to improve their mental health outcomes. Because of this, telehealth platforms have to support the unique work of therapists, which is a fundamentally different design constraint and proposition compared to other CSCW technologies. Most previous research on teletherapy has focused on broad-based surveys regarding therapists' attitudes towards teletherapy. These surveys have revealed hesitation and reluctance in the use of teletherapy due to concerns related to privacy, the ability to establish a strong therapeutic relationship online, and insurance constraints. In this work, we extend the literature on the use of teletherapy by offering a descriptive account of the experiences of therapists who had to transition their entire caseloads online as a response to the pandemic. Our main research question is as follows. In what ways do telehealth platforms support and challenge the work of teletherapy? Before going into details of our study, we wanted to provide an overview of the unique characteristics of therapeutic work. There are three components that are the foundation of therapy: the creation of a physical and emotional safe space, the therapeutic alliance, and therapeutic style. The therapy room is a physical and tangible representation of a safe space. There's a lot of work that goes into designing therapy rooms, selecting the proper lighting, room configuration, and selecting the type of materials such as sand trays, drawing materials, books, or other things to use with the client. There is also an assumption that the space will be private and confidential. The therapeutic alliance is the emotional connection between therapist and client, and it can contribute to the creation of an emotional safe space. Typically, the therapeutic alliance is established both through verbal and nonverbal communication. Finally, therapists differ on their therapeutic style, which can be determined by the population of clients they work with, by their theoretical orientation, or by their training. Therapists may use different activities, worksheets, experiential experiences, movement exercises that are consistent with their therapeutic styles. We sampled diversely to learn how the platform supported the work of different styles of therapy for different types of clients. We interviewed therapists who worked exclusively with children, those who worked exclusively with adults, or those who worked with all age groups. We also interviewed therapists with different areas of specialization, from general mental health concerns to more specialized therapists like art therapy, music therapy, or trauma therapy. The majority of these interviews were conducted during the early months of the pandemic. During this time, in the United States, the federal government, some state governments, and insurance carriers relaxed restrictions surrounding the use of telehealth to provide mental health services, making teletherapy accessible to most therapists and most mental health organizations. For our study, we conducted semi-structured interviews with 14 mental health therapists. Our semi-structured interview consisted of questions to better understand changes in service provision due to the pandemic, the platform selection process, previous and current experiences with teletherapy platforms, and therapist support and resources. We transcribed audio from the interviews and conducted iterative and inductive analysis of the transcripts using open coding and thematic analysis. We also performed member checking by sharing a summary of the results with all of our participants. We had various interesting findings. We invite you all to read more about them in our paper. For this presentation, we will be focusing on two findings: recreating the therapy room and a lack of relational cues. Therapists talked about the challenges and benefits of having to recreate the therapy room online. One of the main benefits of doing this was having to collaborate with their clients to identify what they wanted to recreate online. This process involved talking closely about what worked and what was the most meaningful about their in-person experiences. As stated by this therapist, she had to be creative with her clients to find appropriate substitutes for her materials. So instead of using musical instruments, clients used items that they had access to in their home, such as pots and pans or maybe pencils. While there were some benefits to recreating this therapeutic space, there were also some challenges. Some therapists talked about their clients not having a safe space in their home or having to have their therapy sessions in a car or closet because they did not have a private space at home. Others talked about how certain clients, such as those from low-income areas, were reluctant to participate in video sessions because they did not want to show their physical space to the therapist. This highlighted how teletherapy is accessible to some, but not all clients. Therapists also talked about having access to new types of information. For example, in this quote, this therapist spoke about how the relationship with her client was strengthened because she could be part of her world in a different way. Other therapists talked about how having more access to information, such as family dynamics or home life, was really productive in their sessions. Despite this access to new information, therapists were missing a crucial component, body language, due to platform limitations, internet issues, or how the client configured their space. Many therapists reported difficulties in assessing and interpreting their client's body language. Therapists use the body language to ensure that their client is emotionally grounded or stable. This lack of cues caused many therapists to feel small or to feel reluctant to engage in trauma-sensitive interventions. As shown by our findings, relocating therapy online involved both rethinking the therapeutic relationship and rethinking how therapists approach their interventions. In terms of the therapeutic alliance, there were certain trade-offs in the type of information that was available. For example, therapists had more insight into their client's home life, but they also lacked the much-needed body cues during their sessions. All of this involved a reimagining of the building blocks of establishing a therapeutic alliance, and then how to creatively use the platform features in order to achieve this. Even though some interventions required additional work, there were some that appeared to be well situated for teletherapy. The therapist's presence in the home environment means that they're able to help clients address problems in the moment. This relocation to the client's home offers opportunities that are not possible in a mental health clinic or office, highlighting a superior affordance of teletherapy. Our findings highlight that while therapeutic work can be relocated online, there are costs associated with doing so. First, we need to consider who we may be missing by relocating telehealth online. Although teletherapy can address barriers to care, there are some inequities that can be exacerbated by teletherapy, particularly for historically excluded communities. Second, because of the situated nature of teletherapy, therapists have access to much more information about their clients, and they have to track much more information. The therapists we interviewed expressed feeling overloaded with information or having to use more brain power. So because of this, we need to consider burnout as one of the costs of teletherapy. Based on this, there are several design and research opportunities to support different facets of the therapeutic experience. We encourage you to read our paper for more details. Here, we will highlight one of these. One of these is supporting the therapeutic alliance. So in order to really support this, designers might provide a suite of options to optimize the audio and video in varying ways depending on the content of the session, the client's needs, and the strength of the internet connection. For example, the system could provide an option to prioritize audio and downsample video, which might be preferable when there are significant connectivity issues. Or maybe have an option to adjust the video during sessions when a client might be sitting next to a window or in a darkened room, ensuring that the therapist can better assess the client's facial expressions, even under suboptimal lighting. We really appreciate you taking the time to listen to our talk, and we hope that you will read our full paper. For any questions, please feel free to contact me at this address.